Before we go there, I'm going to bring up our head of security. This morning, he was in a ghillie suit crawling around, so I couldn't introduce him because he was making sure you were all safe. And now he has donned the reflective gear. This is Brian. He is our sheriff, head of security. If you see something that you think needs to be brought to his attention, this is the man. So thank you, Brian.
Thank you guys. Great to be here. Sorry I missed you guys this morning. It is pretty tall grass out there, so hopefully nobody saw me. I did have a verse I wanted to read you guys real quick. Matthew 20:26. Whoever wants to become great among you must be your servant. And that's what I'm here to do, is just serve you guys. If you need anything, help, guidance, whatever it may be, don't hesitate to ask. Thank you.
All right. Thank you. Give it up for Brian. He's going to take the bullets so you don't have to. Angie, come on up, babe. As you know, we have, over the last 4 events now, maybe 5, had Grumpy Seed Exchange. Grumpy Acres Farm is also one of our local homesteader couples, YouTube channel of the same name, and one of the people who have been around this thing longer than even I have been. And now Grumpy G is a published author. He's giving us one of his books, which will be in the library to be given away on Saturday night. Grumpy Seed Exchange. I'm going to have Angela tell you all about it real quick. Just remember the only 2 rules. No cash and nothing that gets me arrested.
Just bring that to the back door and I'll take it. I had Joshua trees I was going to bring, and then I thought, we're going to be in a conservation park. I probably shouldn't. All right. So we're going to do our annual seed trade, plant trade. We had some fantastic sponsors for us. We partner with Food Forest Nursery. If you guys watch our YouTube channel, you know that. Derek is a great guy. He's like-minded. He's just awesome. They donated 300 raspberry bushes to us of each 25 each of each variety. I'm not sure I said that right, but anyway, you get it. If you have questions, you can let me know. The goal here is, if you got something to trade, and trade it. If you have ordered sweet potato slips from me before the event, come and see me before the trade. I want to make sure you guys reserved it. You guys are paying. You guys get your sweet potatoes first. So make sure you come and see me for those. And then everything else, if you didn't garden, if you didn't know, I was supposed to bring something, and you want to try gardening, or just, hey, I do garden and I didn't bring anything I didn't know, please come out. It doesn't matter. Everybody, there's enough for everybody to take something. I just want everybody to start and be fruitful and multiply.
Yeah, that's right. There will be participation-based prizes.
Yeah, I forgot about that. Baker Seed Baker Heritage Seed Company donated a $50 gift certificate. So that is going to be our giveaway at the seed and plant trade. You have to participate. That means you have to take something. So come on over, get something. We're setting up back here. Probably have to figure out more tables because I believe there's a lot of stuff coming.
There is. Yeah.
Okay. And then, so $50. So you'll each get a ticket. Make sure if you're participating to let me know, and then we'll do a drawing, and the person that wins gets the $50 certificate.
Perfect. That's everything. Thank you, Angie. Let's give, and Grumpy G, who's not here yet, but now a published author. 6 o'clock under the pavilion. It'll probably spill out into here just like Bartertown does. You guys know the drill. You've been here a time or two. All right, I'm not going to... one more thing I will say. Rebecca from Red Flyer Media, who does all the camera and AV equipment work for us, is a huge proponent of DMSO. Who knows what DMSO is? Besides those who know it's the miracle drug, right? It's like ivermectin, whatever. Right over here, she has a sampling of some awesome products. And since she does all of our stuff for us, I told her, well, why aren't you over here putting something up to make a buck yourself? So if you're interested in DMSO, want to hear about it, learn about it, see the products that she has, please, when she's not running the cameras for us, come see her and check out her product line right over here. All right, with that being said, I'm very excited to bring our next speaker. He was actually introduced to me by William Bond, who was like, I said, William, I need people who are younger, non-boomer, white-bearded, white dudes talking about bug-out bags. And he's like, well, I know the... Sorry, boomer. He's like, I know this guy named Dayton. Call him. So he made the introduction, and here we are today. So please welcome to the stage YouTube channel star, Ballistic Mischief, Dayton.
All right, let me get this thing turned on. All right. Well, hey, guys. Thank you guys for coming. Like you said, my name is Dayton Bournique. I'm a survival and tactical skills instructor, and I travel across the country and teach at different events just like this, gatherings, conferences, and all of that. I do a lot of survival, so some of the fire making or shelter building or water purification or all that kind of stuff. And then I also marry that with more of the SEER tactical, maybe escape restraint, lockpicking 101, and some more of the tactical stuff. So you'll see me doing a variety of different skills. But today I'm doing a class I've not done before. They said that they wanted me to pull together a class that was a trauma basic care class, but was centered more for the person who might be in the woods or might be off doing something by themselves and gets injured and needs to take care of that themselves. So everything that I'm going to be going over today is going to be with that in mind of you have to treat yourself in an emergency medical situation, specifically for trauma. But before I get into that, I've been a survival instructor for about 5 years. I have been just enjoying doing this stuff for a while. I always had this interest, and it's kind of grown into something that I've taken more and more as a serious thing, and here I am. We're from about 45 minutes to an hour northwest of Indianapolis, so it was a little bit of a hike to get here, but this is about as far out west as I've gone before, so I'm excited for it. A whole new landscape, new terrain, and it's been really cool to see. So thank you guys for having me. If anyone has any questions at the end, if anyone wants to come up and take names of stuff, brand names, if you guys want to try anything out, I'm more than happy to. But just with this setup, it's probably best if you just wait till the end. And then I'm more than happy to answer any questions or do anything hands-on. Yeah, so I appreciate you guys for coming. Without further ado, we'll get started. So like I said, everything today is going to be all trauma-based. It's going to be in a scenario of I did blank and end up with blank injury in the woods. I don't have paramedics or EMTs that are coming on the way, and I have a trauma kit or a first aid kit or a med kit that I've got to try to use now to fix whatever is broken. So obviously the first thing that a lot of people come to mind when they think of trauma is massive bleeding or massive hemorrhage. And one of the best tools that everyone uses that's been proven through time is gauze. And there's several different types of gauze. You've got what everyone commonly will probably see as gauze like this that are just sterile gauze in a pad, and you pull it out, and it's kind of this like cheesecloth material. If a lot of like doctors or nurses, they'll use this kind of stuff. And for trauma, this is essentially the material we'll use, but on a little bit of a bigger level. You have a couple different kinds. You have rolled gauze that looks like something like this or opened up, and it's just that same material that is rolled out just like this. All right, testing. All right, cool. It fixed itself. That's great. So you've got your rolled gauze just like this, and it's just rolled up gauze, same stuff that you'll see in here. And then you've got compressed gauze. A lot of this you'll see in trauma kits or things that you get. This is North American Rescue. It's compressed. So it's same stuff as this. It's just folded in a Z-fold pattern and is compressed. So you can fit it tightly in a med kit, and it's not going to take up all the room in there. So you got your compressed gauze. You also have another category of gauze that is a hemostatic clotting agent impregnated into it. So it is the same thing as this, except it's typically in a packet or something like this. Quick Clot is a great brand for it. And like it says, it stops at 5 times faster because of that hemostatic agent. When you put it on the wound, it causes that clotting to occur at a much faster rate. So those are your main types of gauze that you're going to be going over. The best option for cheapest is always going to probably be your rolled gauze or gauze like this. But it's not terribly expensive just to get compressed gauze. These are on the more expensive side just because of how well they work typically. I mean, I think this was about $20 and it's just one of them. So I don't carry that with majority of my stuff as much, but my main stuff, I will have those in there. So the first thing I wanted to go over is just how gauze works is you've got, let's say, a cut just like this in your arm, in your leg, anywhere that starts bleeding. So you're going to want to take, and you would either take your square of gauze or you would take your roll of gauze, whatever you're doing. If it's something like this, you might need maybe something that's that big. If you have something bigger, you can always use more of that. But you want to take and apply pressure. That's the first thing you want to do. So you want to cover, and even if you don't have gauze and you have to use a shirt or whatever, you're improvising. A lot of the stuff I'm going to talk about is going to be things that you can improvise as well. I'll tell you if you have the gear how to do it, and then if you have to improvise it. But you want to apply pressure, and you want to put some pretty tight pressure right directly over that wound. You don't want it to be anything that's going to you want to put tight pressure. If it hurts, that's probably a good thing. You just want to make sure that you're putting extremely tight pressure on there. You're forcing it to clot. You're forcing it to not be able to flow out anymore. If you have something that is, let me see, I don't want to go too fast. If you've got something that is, let's say, in another area that isn't like an arm or a leg or anything like that, you still want to apply pressure. But I'll show you in a second what you should do for that. So let me look. All right. So like I said, you got just your regular gauze, and that's great for if you have a cut or if you have some sort of any of that going on there, you can put that. You're going to apply your pressure. Another form of pressure is a pressure dressing, or an Israeli bandage is a common one of them. They'll look like this if they're wrapped up. There's some bigger ones, and it's just essentially the same thing as this whenever you open it up. And what you're doing here is, let's say we've applied our pressure, we've put that over there, we've been holding it, and now we've got to do something. We can't just sit there holding onto our arm. So what you do is you take an Israeli dressing and you put the pad right here over that, wrap it. Sorry if you guys can hear my breathing at an extremely loud rate, but you're going to take that and you'll see that it has this clip right here. And you'll take and you're going to put your material through that clip, and then you're just going to wrap it. And what it's doing is this clip's applying direct pressure right over the wound site. So you're going to take and you'll wrap it, and you've got a ton of this here. You can do a much tidier job, but you're going to take and wrap it, and if you want to, you can throw some twists over it, and that's just going to help apply that direct pressure on top of your wound. But you can take and you're just wrapping that tight, and this is really just going to help hold that gauze and hold that pressure right over your wound. So you're going to take, and then at the very end here, it's got a little plastic piece that you can either go and wrap over, and then you can hook this on the sides of your dressing. It's just this little plastic, it's got hooks, and you can take and put that, well, if you can see it, you're just going to take and fold that right over itself. So if this was on a leg or on your arm, you've got your dressing. Now you're actually able to do stuff instead of having to sit and hold that pressure there. So it's great whether it's, like I said, on like an appendage, like your arm, your leg, anything like that. You've got your pressure dressing right there. Let me see. All right, and so like I said, there's a couple different versions of a pressure dressing like this. This is what I enjoy using most. This is kind of an industry standard, if you will. So that's just two things that you'll probably want to have in your trauma kit. If you've got a minor cut, something like that, you've got your gauze, and then you've got some sort of pressure dressing on there. So you can start doing stuff instead of just having to sit and use one of your hands to hold that pressure. Another thing that we're going to talk about is tourniquets. So it goes along with this. Let's say you have something that's a little bit worse than that cut I have on there. If it's something like a bigger wound, a longer cut, you're bleeding a lot more, something you're going to want to use is a tourniquet. This is a Gen 7 cat tourniquet, or at least very close to it. And the brand that you'd want to go through is North American Rescue. You'll see it on a lot of this stuff, or NAR is what they like to go by. You can see on a lot of different stuff, North American Rescue, that's the top of the line. That's the Apple, if you will, of medical gear. It's tested, military contracts, all that stuff. Go through North American Rescue. This is a Rhino Rescue, which I use for classes, demonstrations. There's a big thing back and forth on it, the validity, how high quality they are. That's why I use them for training. Or if you're trying to make a mass casualty kit and you've got to buy 30 tourniquets, instead of spending $35 for every one, you can order a bulk one. And is it going to work? Probably, but it's not going to be as reliable as a North American Rescue, which is what I've got on here. Same tourniquet I've gotten here. It's just what I would like for your family, for your personal kits. get a nice tourniquet, get the nice medical gear. But if you come across other people, you still want to be able to help them. But if you can't drop $35 per tourniquet, get some cheaper options, and it's going to be better than nothing. It's going to be better than a belt. It's going to be better than an improvised tourniquet. So I've got here your tourniquet, and whenever you get it, it's going to come looking kind of like this, where you'll have it folded up, probably be in a plastic wrap, and then that's your tourniquet. Before I talk about using one, I always talk about how I prep my tourniquets. You always want to take it out of its plastic. You want it to be able to be ready to use. You don't want to need to use it and then have to try to unpackage it. I always take and I open it up. The first thing I do is I take and I fold this in on itself. I make a little lip. The reason I do that is so whenever you unfold this, if I've got gloved hands or I've got cold hands and my dexterity starts to leave, I can take and I can just grab this pull tab, and I don't need to be trying to unstick this with my fingers like this. I can just grab directly this pull tab and be able to go just like that. So I can grab, yank that open, and I would put this onto, let's say this is my arm right here, and I've got some sort of stab wound or I've got some sort of gunshot wound, and I've got it in my forearm right here. So you don't want to put these on a joint. You don't want to put them, I wouldn't put it over my elbow. You want to put it about 2 to 3 inches above the wound. So a good way you can do that is you can do 3 fingers, or you could just do a 4 fingers, and then you want to put it above that wound. So I would put it just above my elbow, so about right here. So let's say that's what this is, and I'm all right. I don't want to hurt anybody, and I duct taped these beautiful dummies, so we'll utilize these. So what you'd want to do is you want to cinch that up, and then you can tighten it down just like that. You want to get it as tight as you can when you're cinching it, and it'll Velcro onto itself just like that. And you just want it to be as tight as you can on that first initial pull. So as you get that on your arm, you want to tighten that down. You guys can see I can't fit my fingers under it, so it right there is pretty tight. The second prep that I do before I use it is I take this white piece of Velcro and I almost put like 2 little bunny ears in it. I fold it over. You guys can see I almost have 2 little bunny ears right here. And the reason I do that is whenever I'm using, I'll show you guys later, instead of having to kind of take and use my fingers and try to grab that, I can take this and I can just pinch and I can pull it over just like that. So if I put these, instead of having to try to kind of pull and undo that, I can put my bunny ear, put my other bunny ear, and then I can take and do it just like that with a pinch instead of having to use my fingertips. It just saves a couple seconds. It helps if you don't have the best dexterity, or if you're in a situation where you're hypothermic, or you're kind of losing that. If you're wearing thick gloves or any sort of gloves, it just makes it a little bit easier. So once you put that on, you're going to take, and this piece right here is called a windlass. On North American Rescue tourniquets, it'll have a metal piece inside of it. This one I believe is all plastic, but it's a sturdy plastic. And you're just going to twist it. And you'll see as I twist it, it starts to really constrict on there. And it should be tight enough on your first one that it's like 1, maybe 2 rotations. And then you're going to put it right there just like that. And then you're going to put your little time strap over just like I showed you. And you want to put what time you put this on, because the whole purpose of this is to cut off your circulation, cut off your blood flow. You don't want any of your blood flowing down and escaping out, because you can bleed out in about 3 minutes. So the goal is you want to cut off that circulation, cut off your blood flow. You're constricting all of your blood vessels and trying to cut that off. So you want this to be very tight. It's very uncomfortable whenever you put it on. It does hurt. It's supposed to hurt. If you can fit fingers under it, or if you can pull it, or if it's loose where it's sliding, it's way too loose. You want this thing to be extremely, extremely tight on there. So that's what it want to look like, and then you can throw that around if you want, or tie another knot over it, or do whatever. But that's what your tourniquet should look like on there. So whenever you prep it, it just makes a couple of the steps a little bit easier. I'll show you now that and go through and prep it. I always talk about that because whenever you can die in 3 minutes, saving a few seconds here and there really is a big help. So I always take it and put my strap over. Now I'll take and fold it in on itself just like that. And there's different carriers and all that kind of stuff too. You just want to make sure that's opened up, accessible. Put my bunny ear in it, second bunny ear. And then, like I said, I can take that. You want to throw it out, kind kind of get it open, put it on. You can grab your strap, tighten it down as much as you can. You can give it one good twist, give it another one, put it in there, and grab your bunny ears, push it over, and it just makes things a little bit simpler. So that's your tourniquet. They've got a bunch of different kinds of tourniquets, different models of it. It's just military. Everything they recommend is a cat tourniquet, Gen 7. Got a bunch of different ones. I like these. All of my tourniquets with all of my stuff are all the same. So yeah, that's a tourniquet. That's how you use it. There's a bunch of different people that will do different things with different tourniquets. That I just think that you can't go wrong with a tourniquet that's tested as much as this is. If you go on the North American Rescue website, they'll show the results of their extensive testing. They'll show the comparison between different tourniquets. They'll go through and they'll show all those statistics that they've tested out, and it just by far is the best one you can get. Yeah, so that's your tourniquets. That's how to prep them, how to use them. Those can be used for your legs. Those can be used for your arms. Don't use them for your neck. Doesn't work. As much as it sounds like it would be great to help with your neck, don't put them on your neck. You'll definitely stop bleeding and you'll stop everything else. So it'll be the last tourniquet you put on. But another good thing to do with these is to practice using them, because let's say if I injured my arm, try doing it with one hand and try doing that. Make sure that wherever you have it, like let's say I've got on my backpack strap here, try making sure that like it's accessible. If I injure this arm, I can pull it down, I can put it on. If I injure whatever, do it from different positions. If you carry it on your belt right here and you injure this arm, you can't reach it. You want to make sure it's in a convenient spot you can get to. Put it in your car where it's accessible. You want to make sure that it's in a good spot, and repetition, just having a couple of them in the most common spots that you're at. So you can never go wrong with that. Another thing I wanted to talk about a little bit is improvised tourniquets. So everyone always is like, you can take your belt and you can throw it on your leg. And for some belts that might work, but as close to you can get as this is best. You can take a bandana, or you can take a schmog or something like that. You can take a piece of clothing and a tent stake or a stick, and you can twist it. You really just want to get that pressure down. There's a lot of different things that you can use. You can use a tarp, you can use a trash bag, you can use all sorts of different things, but you just want to get that really good 360 degree around whatever appendage that you're doing that to. You just want to get that really good. Like you can see how hard that's kind of sealing on that. Like you want it to get really solid on there, or else it's really not going to do that much good. If you're still bleeding, when you have one, go up and put another one on there. They used to teach just put it high, and so if I got a big injury on my forearm, they would put it at the top of your shoulder. Well, they're starting to say do it those 2 to 3, maybe 4 inches above that wound site. That way they can save some of your arm, save some of your leg if they need to. Now that our technology's developed a little bit, because I mean, if I've got a huge injury right here and they put it here and I lose my whole arm, when if they would have put it right below my elbow, I could have had at least this. It just is helpful. People say that you can't have these on. They're going to hurt a lot, but you can have these on for a decent, like you can have those on for 10 hours plus, and it's going to be terrible. There's a chance it could do something, but the more that they use these, they find it's just better to have one on than to try to loosen it up. You never want to loosen it. You wait till you got EMTs or paramedics, or you wait till you have somebody else that can take that off. You just want to put it on and do your best to get to a situation where you're accessible. So I'm used to asking people if they've got questions, people throwing questions out. So excuse my kind of fillers. I'm just trying to make sure I don't miss anything. So that's your tourniquet. Like I said, there's different kinds. This is just the one I go with. I haven't experienced a lot with other ones, so I didn't want to bring any up here and talk about them because I'm not as certain on them. But yeah, so always carry some stuff and think of, okay, if I don't have a tourniquet or this is the gear I have, how can I use this kit that I have, or how can I use these items to improvise something if I needed to? So that's something I'm conscious of. I put my tent stakes on an outer pocket. So if I need to, and I don't have a tourniquet, I can reach in, I can help use that to act as an improvised tourniquet. Another thing that is in that trauma category is chest seals. So chest seals, let me see, I've got a couple different kinds. Chest seals might look like this. This is that Rhino Rescue I was talking about, really good for training. You could use it for your own personal first aid kit, whatever. This is North American Rescue. Same brand as this is what I would recommend. This is their compact hyphen chest seal. What you want to do with these is, let's say in your chest cavity, you get a stab wound and they pull the knife out. You get some sort of sucking chest wound and you'll hear it. You want to use a chest seal, or a vented chest seal is preferred. And what that's going to look like, these are a little sticky, so pull them out. So they've got a little bit of like a gauze pad in here so you can help soak up some of the blood. There's not a very large amount of blood that's going to be in that cavity. It's really, you're just protecting and making sure that your lungs don't collapse, or that the air isn't sucked into it and your lungs collapse essentially. So what you're looking at, something like this, you can see these are the vents. This would go over that wound in your chest. And you take that, like, let's say, where's our chest wound? Oh, chest wound. Okay, so we've got our chest wound right here. Say we've got a hole. Then we would take and try to wipe away as much blood as we can, try to clean that up. And then we would take our, oh man, if I can pull it off. Sheesh. This one I've had open for a few classes, so this might, oh, there we go. So it'll rip off. All this is a very sticky adhesive, and you line up your chest seal right over where your injury is, and then you would stick it down. So you can see right there, it's got that air, so it's vented, but it's right over that spot. So that's how you put on your chest seal. Same thing for this one, except it's just a square. So you take, and I also don't know if this one, okay, I guess this one is vented, but it's just would be the same thing. You take it and you put it over, and it would get stuck there. A really cool thing about these is they are very easily improvised. You can take a hotel card or a credit card or anything like that, and if you tape 3 sides of it, because you want it to be vented so you can kind of burp it, if you will, then you can take and you can tape 3 sides of it over that, and then from time to time you kind of lift it up a little bit, let like a little bit of air through there. And then you also can use something like a Cheeto bag. If you cut a strip from that, you can put that over. It's going to act the same way. Those are just some things you can't. Obviously, you just want to try to have as much clean, sterile, whatever you're using. Just try to make sure it's as clean as possible whenever you're doing that. So those are just a couple different chest seals. And that's really important. If you do get like a knife wound, or if you do get a stab wound or something, and whatever object it is still in, don't ever pull it out. You always want to stabilize it the best you can. Use some sort of triangle bandage or whatever. Just don't pull it out. So if in the movies, whenever you see they get shot with an arrow or they get stabbed with a knife and they go, "Ugh," and they do that, that's the worst thing you can do. Just leave that in, because that's helping plug all the holes that it just made, essentially. So leave that in the best you can. And yeah, like I said, a couple different ways you can improvise. And obviously there's other different ways you can improvise it. I mean, you can even use the wrapper for some of these other. You could use this wrapper for, like, there's a lot of wrappers that you could use, and I'm not talking about M&M or anything like that. All right, can you hear me? Maybe. Testing. All right, cool. So yeah, there you go. So I've got, like I said, those are all chest seals. If you guys, like I said, I've got a bunch of other ones up here if you guys want to try it out later. Next, I'm going to go on to splints and stabilization. So some things that you would use a splint for is a suspected fracture, sprains, dislocation, crushed limbs, anything that you think your bones could have been hurt or could have been crushed, or any formation that isn't normal. Whenever your bones break, you don't want them to cut any of your veins or arteries or any of your other parts of your body. So it's best to stabilize it the best as possible. You don't want any movement there. That a lot of people talk about, but there's a couple different kinds of SAM splints that look like this. This is what a SAM splint can be referred to as. It's kind of a foam pad, and in the foam pad, it's got a very bendable metal. So what I could do is, let's say I fractured or hurt my ankle. I could put my foot just like this. I could form my SAM splint to my leg I can use a wrap to help it to be stable. Something like that. You could also fold it on itself, and let's say I need my arm to not bend. I can take and I can concave it just like that. Just kind of work with it. It's like a really thin steel, and hold on to it just like that. Hold it to my arm, and then I can take an ace bandage or something like this and just wrap it up. That way I'm not able to bend. It kind of immobilizes my arm. I can do this with, like I said, most commonly it would be an arm or it would be a leg. It'll even show you on here. It's got a leg, got arm. That's probably most common. You can do smaller ones for a finger, something like this. If you, let's say you broke a finger, you can put one on here, or you could just tie both your fingers together. That way you're just not able to bend them. You just really want to make sure that just subconsciously you're going to keep on acting like it's not broken. You're going to keep on moving it. You're going to keep on doing all of that. So it's just kind of something to help you to not hurt yourself more. So if you've got fractures of two bones, and as you're moving, they start doing this, they're going to cut all of your everything that's important inside that you don't want to cut. So that's what's cool about sand splints. Obviously, it's probably the easiest to replicate or improvise. You can take two sticks, you can take pieces of plywood, you can take anything, PVC pipe, you can take anything as long as it's straight and it's gonna not allow you to bend. You can use that, and that's gonna work. That's gonna work just fine. That's probably. I mean, it's so necessary, but it's nice that it's easily improvisable. That's what's cool about a lot of this stuff is the more improvisable or the more alternatives that you kind of have under your belt, it just works better and better. That way, if you're in that emergency, you kind of have a pre-deficit of thinking of ways that you can improvise it and utilize it. So you have the same effect without the same tool. And then I kind of went over it a little bit, but an ace wrap is really just a bandage that I can take, I can wrap around, it's got Velcro on it, and it would really just be able to help hold that in place. So if I was trying to, this is a really long one, but if I was trying to, let's say, wrap up my wrist and I splinted that, I would take, wrap that around, set it up, really long one, wrap that around, and then I've got this Velcro. Just sit and Velcro it, and that's gonna help. Yeah, it's gonna help it not to move. Obviously, if you have that, so you do that, and then you wrap it around. You got a bunch of different sizes of ace wraps. You got all of that. So it's a good thing to have throw into your kit, especially if you're not seeing before you used it. Some good stuff. And then the last thing I wanted to talk about is burns and hypothermia. So obviously, if you kind of think of the different things that can happen when you're outside by yourself. You got outdoors, but you've got knocks. So you've got those cuts, those stab ones. You trip and fall with your knife, which should be walking around with one, but if you trip and you fall, you might need a chest seal if it stabs you, or you have massive hemorrhage and you're bleeding, so you might need to use your gauze. If you've got fires that you're making, burns is probably something that you're going to run into. So for burns, really the best thing you want to do is it's hard to improvise. You want to be able to put a cool cloth on it. If it's something that's really rough, it's like a 3rd-degree burn. If you burnt through your skin layers and through your nerves, and it's bad, then you just want to put cool cloths on that. That's the best you're going to really be able to do without any gear. But you also can get some burn dressings, which is going to help a lot. You can put a burn dressing on and then put a wrap around it. There's also different ointments. You just want to make sure that it's cleaned out really well. You want to use any alcohol prep pad wipes, any of that kind of stuff, any wound cleaner, that might be something that looks like that. Just you want to make sure it's clean because you're very vulnerable whenever all of your skin gets burnt off because that's your protecting layer, right? So you don't want that to get infection. You don't want any dirt or nasty stuff to get into that. You want that to be just as protected as you can. So right away, you want to be able to put a cool cloth over it, make sure it's clean, and wrap it up. And it's going to suck. It's going to be painful. There's not really much you can do about the pain, but that's your best way to treat it. So you want to get some burn pads, get some burn ointment. There's a bunch of different salves and ointments out there. Or I carry some of these burn dressings that are on there as well. So that's something that is notable since a lot of the dudes that are out in the woods or women, whoever it is, if you're making fire, even if it's in the kitchen, if you're working on a car, you get burned by something, whatever it is, you just want to be able to have burn pads to be able to treat that. And then I said hypothermia. So there's an acronym that TCCC, so Tactical Combat Casualty Care. A lot of people that do trauma stuff and medical stuff, it's called MARCH. So you got your massive hemorrhage, which I talked about first. You got your airway, you've got respirations, you've got your circulation, referring to like blood, and then you've got your hypothermia and head wounds. So I kind of moved down in a basic outline, but hypothermia, a lot of people don't talk about, and it's kind of like it's like an underdog of the category. If you get hypothermia, that can set in and that can be pretty fatal really quick. So you want to make sure that you are prepping for that. There's not a whole lot you can do other than obviously try to warm up as fast as you can, shed any wet clothing. If you took a dip in a very, very wet environment, get that wet clothing off, try to dry off. You can get some nylon blankets or reflective blankets. That will really help you if you can reflect that body heat back onto you. Get into something that's out of the elements, but that's just something you want to take care of. Get hot hands, put them on your spine, put gloves on, put your hat on, put socks on. You want to warm all of those points that you lose body heat and that you can gain it. So you want to do as much as you can for that. Blankets, whatever, just make sure that you're dry before you're putting more layers on. Because if you're cold and you've got wet water on you, start putting all these layers and stuff on, you're still going to be cold and have wet water on you. So you want to take care of that the best you can. Does anyone have any questions? I know I went over a lot of stuff. It's always good. If you're talking about kits, I can talk about kits all day, and you guys can tear these open, check it all out. You want to have trauma shears. That way you can take off any clothes or anything that is impeding your search for any injuries. You want to make sure that you've got whatever, like if there's a fracture, there's something, whatever clothing, popular stuff they're taking is messing with it, you want to be able to get that out of the way. Yes, sir.
Would you keep the Jerusalem dress, Israeli dressing on, and then also put a tourniquet on it?
So a lot of times, what I would do, that's a great question. So a lot of times, if it's a smaller cut like what I showed, unless it hit an artery and it's spurting blood and it's like you can't control the bleeding, I would probably just apply your pressure, put your gauze there, and then put your pressure bandage on. If it is something that, like I said, where you hit an artery or you hit a vein and it's a lot of blood that's coming out and it's pretty bad pretty quick, I would put your tourniquet on and then same thing with that pressure and put one of these on it as well.
Okay, so they wouldn't go together, they would be apart.
Yes, so your tourniquet would be wherever, about, like I said, about if you put your four fingers above whatever your injury was, and then you put this directly over the injury. So the tourniquet doesn't go over the injury, it goes above it to cut off that circulation, cut off the blood flow, and then your Israeli bandage goes over it to apply direct pressure to the wound. Does that answer your question?
Yes, thank
Great
you.
question, of course. Yes.
Any other questions?
Yeah. Yep.
If you're doing it yourself.
Yeah.
The other question is, if I have a suction chest wound, do I pack it?
So there's a couple ways that you can go about it. So I didn't talk about packing wounds. Thank you for bringing that up. So what he's referring to as packing is I have right here, I've got a wound just like this. Let's say it's a bullet wound. Let's say it's some impeding wound. You tripped and you fell onto a stick and you pop back up. What you want to do for something like this is you want to pack it. So what he means by that, or what I'm going to show you, is you take your gauze, you want to wrap it, put it in your finger, you want to stick your finger all the way down and go as deep as you can. It sounds really gruesome, it's going to hurt a lot, it's going to suck, but you want to go to where the very start of that bleed is. So you want to go down deep, you're going to take your other finger, you want to push it down before you pull it out. That way you have your constant pressure there. So, and like I said, I repeat a lot, it's a lot about pressure. You want to go all the way down, and you're just going to keep on doing that as much as you can. Just re-packing, and you want to make sure you go all the way down, and you're applying that pressure before you pull your other finger out. You can do that with your thumbs. You can do it with whatever. Once you get to where it's like flush with your skin, you pack as much as you can. You can take the rest of your roll, put it on top, and apply pressure. Then you can put your Israeli, put whatever you want. That's how you pack your wound. What he asked is, would you pack a sucking chest wound or something like that? You would not want to do that because the reason you're packing is to stop the bleeding, right? That's the biggest thing you're worried about. In your chest cavity, in your abdominal cavity, you're going to bleed a little bit, but you're not going to be spurting, just shooting blood straight out That's why you want to use your chest seal, is to help vent it. You're really worried about your lungs collapsing. You're not as much worried about any of your places that are heavily with arteries. So like anything right here, in your thighs, anything your wrists, your arms, all that's your armpits, all that's arteries that you're trying to stop bleeding. Right here is all going to be like your chest cavity. You want to make sure that you're taking care of your lungs not collapsing. If you're trained as a paramedic and can use a decompression needle, something like that, but you wouldn't want to pack a wound like that because it's just going to keep on filling that cavity. You could go through however many gauze and it's just going to fill your entire body with it, and then it's going to really suck whenever you get to the hospital. They got to pull it all out. So that's what you want to use your chest seal for. You would not want to pack like a chest ring or something like that.
In the cars, do it yourself, just make sure it's, there was one way to wrap it, one way not to. They taught us not to go from there.
Yeah, so as far as strength, what it's saying is to make sure that it's in a spot you can get to it. It's in a spot that you're able to pull it, you're able to maneuver it and stuff. Is that what you're? Yeah. So you just want to make sure it's accessible to where you can do it to where you're at. It's not in like you don't have a position. You want your windlass to be as close to right here as you can. You don't want to put your windlass right here because then you can't really get to it. You can't maneuver it as well. You want to be able to see what you're doing, keep it all kind of upright. But if anyone has any questions, feel free to yell it out. Yes, sir.
In rewarming patient, so far as I understand, thought still you don't want to too rapidly warm the extremities because as the person is getting hypothermic, the blood flow to the extremities will shut down, and that blood in the extremities will get very cold very quickly. And so if you like put them in a tub of hot water or something, all those little valves that are shut open back up and immediately flood the body core with cold blood, and
Right.
it's like a second hit with the hammer.
Yeah, so that's a great question. So you don't want to warm up too fast. Same thing if you've got frostbite, you're out working, your hands are starting to turn really red or, God forbid, purple into black. Really, you do not want to go get hot water, get a hot shower, because that, like you said, it's going to probably just kill all of your nerve damage. That hot and cold, it's not going to work well. If you're in a very early stage of it, like let's say I was standing, I'm fully dressed, I jumped into 20-degree water, 30-degree water, just freezing lake. I managed to get out of it. Right then, I'm not in severe hypothermia, so that's where I would want to strip down and immediately just try to do the best I can to get as hot as I can. So sit by a fire, heat-reflective blanket, out of wind, whatever I can do to put an extra blanket on, whatever I can do to have as much body heat as quick as possible. Because at that point, it's my nerves aren't going to be damaged. Whereas if you, let's say you're out working and you've been working all day, your toes are numb, you get back and you're inside, your hands are like discolored. If you, like I said, like you mentioned, if you're like just freezing and you get into a hot shower right away, it's going to cause a lot more damage than it is good. So that's a great note. You want to make sure that if it is something like that, put it in like room temperature water, run your hand over, start to kind of warm it up as you go. You don't want to go like boiling water right after your everything's frozen. Yeah, that's a great point.
And if you're doing running water, put it someplace that isn't cold, where you still have feeling.
Yep.
And you don't want it to be hot, because if you rewarm like distal extremity, like your hands are cold to the point where you've lost feeling, it will feel like they're being crushed in a vice.
Yeah, it'll be extremely painful.
It is unbearable.
Yeah, absolutely.
You want to gradually warm that up.
Yeah, for
so
sure.
If you do it like to a kid or whatever, it's especially important to start with very tepid water and slowly.
Yeah, that's a great. Obviously, look, that just reminded me for kids. Some tourniquets won't work for kids just because if their arms are too small or wherever it is too small, it just won't work. They have some rubber style tourniquets that almost like if you're getting like an IV put in that they'll put around your. They've got some stuff like that. But yeah, just as a FYI, a tourniquet like this probably would not work for a kid. It would probably have to be someone that I would say is at least a teenager, probably like 8 to 9 and up, just depending on like if it's a super scrawny person, it just won't work because as you can see, there's a bit of a plastic component that has to be bent there. If there's just not enough volume to do that, then you can't help. But yeah, if anyone has any questions, feel free to ask them now, and if they want to come up. And I've got different med kits and trauma kits that I've built out here. that you guys can look at. I will kind of move all that stuff, and I'll be over there if anyone wants to look through gear. I love to talk kits. I build stuff all the time, and I love loading out stuff, talking about brands. For these med kits right here, this is called Tough Possum gear. You can see the logo. I really like the dude. He makes some really cool stuff. He does a lot of bags and pouches, and it's got glow-in-the-dark reflective strips on there, glow-in-the-dark beads, some cool stuff. But yeah, if you guys have any questions, or if you want to come and try any of this stuff, I'll be here all weekend, or just yell out any questions.
Any more questions? Hold on, Pat. Let me get.
On the chest seals, what if you're wet?
You want to do that? That's a great question. So if you have, let's say, someone with an extremely hairy chest or a wet chest, you want to do the best you can to dry it off. Same thing with like blood, whether it's water, whether it's blood, and that's why they'll even come with a gauze pad that's wrapped up there. You want to do the best you can, dry it off, get any blood off of there, control any of that bleeding, dry that off. If it's a hairy chest, if it's a trauma patient and they're really needing it quick, you might skip that part. It's a really adhesive, like it's really sticky on there. But you want to do the if you were able to, if you have a razor in your trauma kit to shave that off your stuff, it's essentially an AED stickiness level on there. So if you ever seen a pad of that, it's just this really like fly trap kind of sticky. So if it's got a hairy chest or if it's got water, it still probably work, but you do want to get as much liquid because you want to keep that liquid out of your lungs if there's a puncture in it. So you want to keep the best you can kind of control that. So yes, does that answer your question?
Okay, I have a dog that's always getting hurt, Skip, running around. I've built him a Skip trauma kit. I also, literally, he needed it. I also bought from Refuge Medical a tourniquet for him, sized to him. Could you use that on a child?
I'm not sure. I've never done anything with animals. I've not seen that specific tourniquet. I've not tried it out. I imagine if it is sized for a dog, that it could work for a kid. Obviously, you want to use whatever medical stuff is purposed for whoever it's purposed for. And I wouldn't recommend using anything for animals for kids. And that's another great thing that you remind me of. None of this is professional. I'm telling you this. I'm not endorsing anything. I'm not a doctor. This is not professional advice in any way, shape, or form. This is just a outlet that you guys can use as whatever information you please. But I would imagine it probably would work. If it's made for something that's very thin diameter, I imagine it would probably work. But of course, I would just try to go for the whatever professional option you can for a kid. But yeah, I would imagine. Yes.
I was just going to say that as far as kids' tourniquets go and dogs go as well, rats' tourniquets are actually designed to be able to be used on kids, dogs, adults, all the above.
Yeah.
You just got to get familiar with how to use them because
Yeah.
they're completely different than what a cat tourniquet is.
Yeah.
Rats.
Yeah, so he was talking about, like I said, this is a cat tourniquet, CAT cat. They've got SWAT tourniquets, they've got soft tourniquets, they've got rats tourniquets, like I was saying. There's a bunch of different kinds. They all do the same thing, but just in different ways, and they are used differently. Is there any other questions? Like I said, if you guys want to mess with any of this stuff, if you want to get any brands, any brand names, any of that, more than happy to.
You're not covering
No, I'm going through like just basic like trauma stuff. So anything that's a severe like I said, that March acronym is like went through like you got all those different things. That's kind of the order of which things are going to be most deadly. Obviously, if you bleed out, then I'm not going to be worried about splinting something before that. So I'm going to be worried about bleeding first. I'm going to be worried about airway. I didn't go over a lot of airway stuff because it's kind of hard to do whenever you're by yourself. You can't give yourself CPR. You can't you could put a nasopharyngeal or an OPA or any of that. So you can put that stuff in, but if it's on yourself, it doesn't work as well. So that's why I didn't address that as much. This is all stuff that you can do to yourself. That's going to be able to be useful stuff that you can carry with you that you can get. But yeah, if anyone's got any questions, feel free to ask them. If you guys want to come up, look into this stuff. I've got a bunch of my own personal med gear and equipment and stuff in here too. So one thing I'll talk about real quick is if anyone's ever seen this, it's called bleed stop. And this is a compound that's very similar. It's a hemostatic compound, but it's a powder. And instead of it being like impregnated into these gauze, it's just a powder that you take, you rip it off, and you put in your wound. This I thought was really, really cool when I first learned about it. I thought it was a cool thing throwing all of my med kits. But they're in lawsuits, and people have found that if any of this dust for any reason goes from your wound or goes back into your eyes, it will very, very likely go blind. So you don't want to use this stuff unless, I mean, if your leg is chopped off or something, you can't control your bleeding. You rip this off, I'm pretty sure you'd rather be alive than die. And if that's something, the odds of this getting into your eyes are low. But that's just something I like to warn people. I have some of this in some of my med kits. So like if something crazy is going down, I can put that in there as an extra layer. But I just like to make people aware of it because it's not like it says on here like can cause you to go blind permanently. So I just like to address that too. To each his own if you want to use it or not. I'm not going to say one way or another, but I stopped putting it in my main kits or any of my kits that are in my car or anything like that just because it's not worth if somebody doesn't know that or if it's today and you rip this off and anything gets in your eyes, like could very well have very bad vision loss. But
I've never heard that before.
yeah, no, and they're at Walmart. They're everywhere. I thought they were so cool. I was like, oh, this is awesome. You don't have to spend $20 for one gauze. You can take that, dump it, and you're good. But yeah, no. So just like to keep people aware of that. Just a little quick funny thing. Don't use tampons to try to plug gun hole wounds. It doesn't work as much as you think it does. It doesn't work. You say that in front of people that know what's up, they'll think you're not in the know. And if you've ever seen people that try to cauterize wounds with black powder, I've heard that it works. I wouldn't recommend it. I'm sure it hurts a lot. But what people mean by that is like they take black powder from like some old musket or from if you reload, take it, put it on their wound, and light it on fire, and it would like stop it from bleeding. Essentially, like, give it all was a clot and everything. I wouldn't recommend that either. Probably get an infection. Probably won't work. But yeah. But it sounds really cool. And if it does work, you can tell everybody that you just burnt your cut. So yeah. Yeah, I don't know that. I've not used it on someone. Yeah, I'm sure it doesn't feel
The early
good.
stuff caused burns.
Yeah.
It was bad.
Yeah, I'm sure it doesn't feel good either way, but yeah. But yeah, if anyone's got any questions, feel free. I mean, all this stuff's all loaded out, med kits and all that. So if anyone wants to check it out, you're more than welcome to. And yeah, if anyone thinks of any questions later, you can find me over here. I can't promise I have an answer, but I can hopefully direct you to somebody that does or find out that answer for you. But thank you guys for listening to me rant for an hour. Like I said, you guys can follow me. Thank you guys.
Thank you, Dayton, so much. Good job. Kid's only 18, and he's doing more than most 30-year-old preppers I know. So let's give it up one more time for Dayton. All right, the next thing up here is the seat exchange at 6 o'clock. Enjoy your day. Make sure you go to Lost and Found if you've missed anything or if you're looking for anything. If you find anything, go buy some tickets, buy some swag. Let's keep on the march until the seat exchange, and then I'll see you all tomorrow. Have a good night, folks.